everybody, welcome to another live here today. I am very excited because I have a new guest coming on, one that I have not had a live with, obviously, but his name is Dr. Brian Mekelburg, and he is a dermatologist. And as a lot of you know, I am very, very picky when it comes to doctors and who I send my clients to. It is something that I think it's really important to have as an esthetician. It's important to have, our team people out there that we know that we can trust, and that that we know they can take care of our clients and sort of help us work with some of these skin conditions and things that a lot of us are dealing with as esties. So I'm going to look for him. I want to just mention to you that we are going to be talking today about some specific things that I find really challenging in my business, and that is dealing with rosacea, eczema, dermatitis, and these little things that we call sebaceous hyperplasia, which are just such a pain, and it's just really good for people to know, how to work with them, and especially for us esties, number one, to be able to recognize them. I did put a picture up there to show you what they look like, but just to know how to treat them and how to get rid of them. And certainly we need our dermatologists to be able to help us with that. So I'm going to get Brian on. I will do another little intro once he does come on. And Dr. Mekelburg, I said to him earlier today, I'm so used to calling him Dr. Mekelburg, but the Brian is going to slip in here too. So he's an amazing dermatologist, and I'm going to get him on here right now with us. So bear with me. Hello all, how are you? It's so great to be back and see you all here. Hold on one moment. Here we go. Added him, so let's see. And this is Dr. Brian Mekelburg. He is here in Los Angeles. Hello.
Hello.
How are you doing?
I'm terrific. How are you doing?
I'm really good.
Great.
Well, that was easy.
It worked.
Press of a button and
yeah.
I just want to say a couple of things, Dr. Mekelburg, before we get going here. I first heard about you over 20 years ago, and you were referred to me from a client of mine. We have mutual clients, and I have to say, in being in the business for as long as I have, 42 years, that it's really hard to find a good dermatologist. And I say it's hard because it's hard to find a dermatologist that is still just a true dermatologist, that is going to treat, basal cell cancerous, moles, anything that is derm related. It's just really hard, and it has been very difficult for me. So I am so grateful to have found you, because not only have you helped me over the years, you've helped many, many of my clients, but you've also helped my son, so you probably don't even remember, but
yeah. A wonderful young lad. Yes.
Yeah, thank you. So I think that, it's been more than 20 years that I've known you, and I'm just really happy to have you on here, because a lot of my following internationally are estheticians, and, we need help with some things, with, obviously things that we cannot work with. And I'm going to, I know you've been a dermatologist for over 30 years. Could you just sort of give us a little bio, a little background on you?
Sure. I'm a native of Los Angeles, and went to school locally, Pomona College. Went to medical school in Boston at Tufts University School of Medicine. Came back here and I did a full internal medicine residency first through Harbor UCLA Medical Center down in Torrance, and then on top of that, a dermatology residency through UCLA, combined UCLA VA program. And went straight out into private practice in the same building where I've been the last 30, just say 30
gosh, really? Oh, that's
yeah.
amazing. And that's Cedars-Sinai. You're right there in one of the buildings on 3rd Street, right?
Right.
Out of the hospital. Yeah, no, that's fantastic. So I wanted to talk to you about something that I see so much in my business, and it is it's these little donut looking, you know, hardened sebum. I mean, that's what I say to my clients. You know, this is hardened sebum. It's these little donut looking things that you can get anywhere on the face. And
Sure.
I seem to notice it on my clients that are not, you know, probably maybe I'll start seeing it in their 30s, 40s, certainly 50s, you know, the older they get. It usually does tend to be in clients that may have been more oily. Obviously, I you know, you can squeeze them and a tiny little bit comes out. Now this hyperplasia, sebaceous hyperplasia, little spots that we see. And I did call you up at one point and ask you, and if, you know, how to work with them. And if you wouldn't mind just sort of sharing with us Estes, because, you know, obviously we can't treat them, just what can be done and
Absolutely.
where one has to be cautious or not, you know?
Of course. Well, first off, yeah, the skin is blanketed with oil glands, sebaceous glands, as you know. And in those little spots, they're just overfilled oil glands. And we call them sebaceous hyperplasia. And I tell my patients, you know, the bad news is you got these bumps. The good news is you may look younger longer because you're more oily, and it's part of what keeps your skin, you know, in good shape. You have to make them feel a little better about it. And they may go up and down with the weather. In warmer weather, they may become more prominent. In cooler, drier weather, they may be flatter. And they are difficult to extract, and I know you guys aren't allowed to start poking folks. Mm-hmm. Sometimes a mild extraction might work to flatten them out.
Yes.
But and you can, you know, see how that goes. You don't want to push too far on that. But what I do is usually with a little local anesthetic, I flatten them down with a little light electrodesiccation, and then we have just a comedone extractor, and we empty them. And typically it will leave a little bruise, and they're going to be scabby for a week afterwards. And most people don't care because they want to get rid of these things.
Yeah.
I do also let them know there's a chance of them refilling, because we can't excise them because it's a blanket. It's just a little place where it's just overfilled in that one spot. So we flatten it out, and the skin will heal over. Fair skin folks do a little better than more olive skin people as far as the chance of excess pigment afterwards. But most people do fairly well with the extraction method, and we you know, just we go from there. You know, I tell them they could refill within a few weeks, or it could be months to years before they come back. Now, some can be quite large, and those are the ones we may actually shave them off, and I may actually biopsy it, because occasionally a basal cell carcinoma may look similar. The sebaceous hyperplasias we kind of characterize as yellow little bumps. They may have a little central dell and some telangiectasias, some little red blood vessels. And basal cells aren't quite as yellow looking, but they can be, and sometimes it's better to just double check if it's a really big one. But and the typical place we see them is the forehead, and usually the upper cheeks, the temples sometimes, and most of the folks are happy after the extraction.
They're so happy. I mean, I have a couple of clients. I mean, I know you see them quite regularly, but you know, it's always interesting because every time they come in to see me, they say, you know, do I need to go back to see Dr. Mekelburg, because we start to notice them coming back a little bit. But the great thing about it is, you know, what I found, you know, you've been able to remove them really successfully. I mean, you know, obviously with when you're dealing with skin and people that are more olive, one has to be careful. So it's just great to have a method of being able to remove them and not leave hypopigmentation or hyper, because I've sent you, you know, I mean, some of my clients have, you know, different colorings, you know, you've been able to do an amazing job with them. And but it is something that us Estes just can't treat. And like you said, we can squeeze it a little bit, and yes, a little bit will come out and it'll flatten it slightly. And using, you know, the mild retinols that they're doing on a regular basis, or alpha hydroxy acids, help a little bit. But once they're there, we do have to send them to you. You know, that's how to get rid of them. And
happy to see.
So it is really, that's great. You know, you mentioned about the little basal cells and the basal cell carcinomas, and you know, obviously not being a doctor, when my clients come in, and if I see something a little bit sus, a little bit of that dry skin, that ruddiness with a little bit of dryness, or sometimes if it bleeds a little bit, or, you know, they're telling me, it's something that is really important for people, you know, for us Estes to know. If you see something that's, you know, a little bit sus like that, like a little round spot or something, we do have to send them to you guys. I mean, you're the pros with this, but even like little bubbles, Dr. Brian, I'll say, even like little bubbles, like clear bubbles, I've seen them on the nose where it's just been an absolute shiny little clear bubble, or on the eyelid around the eye. And what I'm noticing now is that I'm noticing, you know, they're coming back saying, yes, you know, precancerous something. And it's things that I never, you know, 10 years ago, I never would have thought would have been in the line of a precancerous, you know, problem. Yeah. But I'm seeing, like, you know, there's little bubbles. Sometimes they're not a mole, you know, they don't have that texture, but they're completely smooth, which is interesting too. That is there sort of something that you can maybe tell us even about the clear little bubbles that I've seen on people that have been a cancerous problem, you know?
Well, the characteristic description, the classic description of a basal cell is usually, the term we use is pearly color, and they can be somewhat translucent. It may be a smooth little bump, and it could look like a mole. One of their characteristics is, the majority of them, there's some exceptions, but the majority tend to bleed easily. And just mild washing and a little washcloth, and suddenly there's a drop of blood that, you know, just doesn't seem like it should happen so easily. And yes. That's a characteristic feature of them. There's some tricky ones that don't do that. And, you know, whenever there's a question, you know, send them in and we look for those things. But beyond that, there's some other growths that also mimic basal cells that you're going to find on the face that you don't need to worry about. Certainly, you know what the milia are. There's the little white bumps. Oh, yes. They're just filled with a little dead skin, some keratin, and those we see on the eyelids, on the face. And they're a little more characteristic, and they're much more uniform in their, you know, little dome-shaped nature. Yes. The other thing is something called a fibrous papule of the nose, or simply a fibrous papule. And it could be a little flesh-colored bump. It may look like a mole. They bleed. They're made of blood vessels and fibrous tissue, and they bleed like crazy. If they get scratched, you know, people will say, oh my goodness, you know, just get the mop. So they're... But they're completely harmless, and they are frequently found on the nose. They can be elsewhere on the face.
Oh yes, I've seen those. That's interesting. Yeah, and it is on the nose. That's right, absolutely. Right. Oh, that's good to know.
And then so just now, regular moles. Yeah.
Now, what I've noticed with a lot of my clients that are having getting fillers done, and even myself, you know, I've had a little filler in my nasolabial lines years back. It's burst some blood vessels, which is, you know, I'd sort of had people often when they've had nose surgeries and different things done, they end up with a little burst capillaries around either the sides of the nose or, you know, a little bit of Cuprose on their cheeks, or, you know, in my case, I got it down here where I'd had some filler in my nasolabial lines. But I want, you know, people to know too with blood vessels, because what I do as an esthetician is I'm always, you know, using ingredients that are going to support the little blood vessel wall to stop leakage. So I'm going to go more to my, you know, my arnica, my bioflavonoids, my vitamin C, things that are going to support the blood vessels.
Right.
And just to help, because as we get older, our skin gets thinner, obviously, and things become more visible as we do get older. So I wanted to ask you, just in treatment of capillaries too, there's a form of a coagulation, isn't there, done that I know I had, you know, with heat, it just coagulates, right, the blood vessel. And then what's the best treatment for capillaries once you've actually can see the capillary wall itself, and it's right. Very red, right. You know, that, like, what's the best treatment for that?
There's well, back in the old days, we would use an electrical gadget to lightly dry them up, you know, electrodesiccate them. And we have replaced that more or less with lasers these days. And there's a couple of different technologies. And the lasers are interesting because the light will pass right through the vessel into, the target is the red blood that's in the vessel.
Oh.
And so it'll go right through the wall without hurting anything. A little micro heat causes the vessel to to shrink down, and the vessel right in front of us goes away for the most part.
Wow.
There's a couple different technologies, a couple different lasers with different wavelengths, but the essence of it is it's selective photothermolysis. Sorry to throw out a big word, but that's what it is the hemoglobin, the oxygenated hemoglobin, is the target. And so the red stuff absorbs the energy, the other areas are left alone, and the vessel quiets down. Sometimes they come back after treatment, sometimes they don't respond. It depends. And what we don't want to do is leave tracks or, you know, be so aggressive that, yeah, we knocked out the vessel, but we left a mark behind. So sometimes they can be tricky, and different skin types, again, you have an issue with color changes afterwards. So again, the more olive skin types have to be a bit more careful.
Yes.
But sort of the classic ones on the sides of the nose usually respond quite well. We use it's called a YAG laser is what we use on those.
I had mine done, probably treated maybe, it was maybe 25 years ago. And I remember it hurt like crazy. Oh my God. But it was so quick, and it never came back. And I was just needle. Like, oh, yeah. It was amazing. You know, it was fantastic because it really bothered me having it there, but it really hurt. So I was just, but you know, a lot of people, you know, capillaries and ruddiness, and people today, they have more inflammation. So I'm noticing, you know, there's more ruddiness, and of course, you know, but it's the ruddiness is the ruddiness. It's not like where you can necessarily just see the blood vessel wall. And so when my clients, you know, when you can actually see the outline of the blood vessel wall, you know, it's when I'm going to mention to them there's something they can do if they bother you. You know, and it is, again, going to a good dermatologist, of course, which is very important across the board, to be able to have the treatment done successfully. And sometimes they do come back, but, you know, often not. And often it's just new ones coming up. But for people to know is, you know, as we get older, our skin gets thinner, it becomes more transparent. We are going to see things like this. It's not, you know, it's normal, really, that, you know, it's life, right? So I think that's really great. And then also now, you know, on the topic of sensitivity and the amount of people that have rosacea, I feel like, you know, there's many different levels of rosacea, but not only that, I find a lot of people come to me saying that they have rosacea, maybe because they've either looked it up in a book or, you know, and feel they've got a little bit of ruddiness. But it's also, you know, sometimes I think it's just cuperose. You know, it's just dilated capillaries. It's not the rosacea with the, you know, the pustules or the irritation. But I am finding more and more people with the inflammation in their body, you know, in which case I'm taking them off their inflammation foods. Can you shed some light to us, you know, about rosacea, and just, are you in your practice seeing more and more of this yourself, and how you know, how you work with it and how you treat it?
I see a significant amount of it. And we think of it as just very hypersensitive skin to begin with. And often it's a fair-skinned person, but someone can be much more dark-skinned and still have rosacea. And we break it up into two different categories broadly. One is the ruddiness, as you say, and they don't get pimples, but they just have flushing. And so just to be ruddy is one thing, but they flush easily is another feature of it. And it does tend to be more central face. And the other part would be the pimple part. And they can be little red bumps, they can be pustules or almost cysts. So, and there can be a combination of both. So one of the very first moves would be, you know, instructing your clients to be very, very gentle with their skin, because things that rough it up will anger it and it will look angry, and that's the last thing that you want. So I advise against both chemical and physical exfoliation for somebody who has such sensitive skin or rosacea. There's a lot of folks want to be doing extra things, you know, to help themselves. And it turns out that a lot, you know, if they're breaking out and they're red, they think that washing, you know, more intensely might be better, when frankly it's the opposite. The less they do, the happier the skin is. You want to be more kind and gentle to it. And there, over the counter, there is the use of benzoyl peroxide washes can be helpful. A very low potency, 5% or less, which you can get over the counter, will help the pimple part. The red part is much more difficult to deal with. Beyond that, if they're really breaking out a lot, they do need to see a dermatologist, and there's some good stuff that we can do. The sun is a trigger for the redness and for, you know, the entire event, in fact. So wearing a sunscreen, a broad spectrum sunscreen on a daily basis, is a very good idea for those who have rosacea. And we were talking about the little red ropey blood vessels for which we use that YAG laser, but for the broad, just they're red, they're pink, and you don't see the vessels as directly. We have a different laser that we use for that. It's called a pulsed dye laser. That's been around 20 years, but it's still the gold standard. And it's usually the first laser for the ropey ones can be a one and done, but for the background, you know, intense redness, to knock it down usually takes at least 4 to 6 treatments, about a month apart, but it's very successful. And being, you know, I guess being gentle is my bottom line with rosacea patients.
I know there's a laser that I think that you have now that is, you know, good for the rosacea, isn't it? I know some people were doing the IPL, the photofacial, so, you know, obviously that for removing the little brown spots, but also some said with rosacea that also helped with the ruddiness too. Was there? Is there another type of laser that you do, especially for the rosacea?
The IPL stands for intense pulse light, and it's a very broad spectrum of light, and it's sort of you know, throwing a bunch of darts at, you know, at the wall, and some are going to stick. And so the certain frequencies, or certain wavelengths of that light are going to knock down the redness, and others are going to hit the brown. So you can do red and brown at the same time with intense pulse light photofacial IPL. The pulse dye laser is a single wavelength, so it's much more attuned, again, to the blood vessels and to knock out the background, the red part. But IPL can be used. We like the IPL very much for the red chest, and sort of the décolleté that just stays red no matter what. They're wearing a collar and buttoned up, and they're still red underneath. So it can knock that.
Doing what you should be doing, right? Protecting. Right.
So the IPL is useful for that. The IPL is also very good for the little freckly brown spots on both face, chest, and on the back, the little brown spots on the back of the hands. It can be very useful there as well.
Yeah, no, and it doesn't damage, like I'm not, and people that know me, I'm pretty outspoken about lasers and going it too aggressive too quickly. I'm more of, doing things moderately, more often, whether it be skin related or lasers and things. And I've just, obviously seen a lot. And I know that, in how you work with our clients too is, it's very successful. They get tremendous results, but they don't have they've not lost any pigment. Whether you're treating the décolleté, which is such a hard area to treat, the skin gets so thin there. And I always say to people, you can lift and tuck your face, but your décolleté and your neck, which gets so much sun damage when you're driving even. I mean, a lot of my clients, they've got those scarves in their car with the SPF in it. They wrap around their neck. And I'm saying constantly, you've got to protect it, because once it gets thin and, wrinkly, I mean, for goodness sake, there's not a lot you can do. So, but I do know the IPL, what you're saying, is very successful for the ruddiness and the brown, the combination of the two. It's one of the most important things. On an internal level, I have found that for people that have rosacea, I am prescribing to them, which is the only thing they know that's helped a little bit, other than taking them off their inflammation foods, their tomatoes, their bell peppers, their spicy, their red wine. I'm prescribing to them the psyllium husk powder, which you can buy from Whole Foods or Trader Joe's, sort of just to help with the gut a little bit. And somehow I found that helps with rosacea a little bit. But in combination with taking them off the foods, the inflammation foods, I found that to be about as much as I can do, other than, soothing, calming, they shouldn't be having hot showers and steam and nothing too hot, not hot drinks, not hot yoga, nothing like this. So I think that
you're correct. It is an inflammatory disease, and it is characterized by inflammation. And the medicines that we use are anti-inflammatory for it. So it's there's the classic food avoidance items would be spicy foods, hot foods, coffee, tea. Unfortunately, alcohol causes tremendous flushing, and maybe a little bit here and there is okay, but if you do tend to be more red, but it makes sense to use anti-inflammatory foods as well. I will mention that there's actually two of them. There's topical, they're prescription, but they're like Visine for your face. And so they don't knock out the redness completely, but they will for a temporary time. So that if you're going out, you want to have a drink at dinner, you don't want to look like Rudolph, you put the stuff on, and there's two of them.
Helps a little.
I won't mention brands, but they're available by prescription. But they work for 8 to 12 hours. They're not perfect, but at least for in a cosmetic sense, they're very helpful. But that's besides the laser, that's the only thing for redness that we can really prescribe.
Work with. Now, there's dermatitis and eczema. I've had dermatitis in my life. I had it on the tops of my hands. It was funny, it was in my first marriage only, really, that I experienced this. So clearly there's a lot more to it. I've had a few marriages here. But I experience on the tops of my hands when I get stressed. Okay. So there's, the difference with dermatitis and eczema, seeing it obviously, around the eye a lot, the topical eczema, which, makeup, different things can irritate it there. The sides of the nose, I find a lot of it stress related on my clients. And what I found is, it's very tricky in that, I'm just very direct with my clients. It's like, sorry, but the over-the-counter hydrocortisone creams are not going to nip it. Usually you have to go to a dermatologist. There's about 3 brands, Brian, that I found to be, either one of them's going to work or it's just not, in which case I'm saying, no, go back to your dermatologist. Tell him, you should notice a difference after 3 days, right, of using these, whether it be a steroid cream or whatever it is, these creams. But with eczema and dermatitis, if it is something that we've determined is not from a makeup, and once they've gone off it goes very quickly. If it's something that stays there, that maybe is stress related, which often, you see on the sides of the nose, is what I'm seeing is, I do send them, to you, to get a cream. And sometimes if it doesn't work, I want people to know, well, there are a couple of different options, because shouldn't you notice a difference within 3 days of using it?
Typically, yes. And
yeah.
Part of what you're describing, there's a very, very common dermatitis called seborrheic dermatitis, which is a dandruff-like condition that affects as many as 1 out of 5 people. Mm-hmm. And we actually use a very, very safe non-cortisone cream for that. It's an antifungal. Don't ask, but it works. I can explain it, but you don't want to hear it. Yeah. At any rate, but it's a condition that we can treat, but we can't cure. And so that is the safe way to go. There's some other non-cortisone anti-inflammatory creams that are by prescription that we can also use if we have to. But there's other kinds of, irritant dermatitis that can happen from, dry weather, if one has sensitive skin to begin with, excessive cleansing, eye makeup remover. The eyelids can get they're very sensitive and can get irritated. One of the quick, cheap, easy things that I would suggest first for the eyelids would just be plain Vaseline, which has no preservatives, anything else in it, and it won't sting or hurt the eyes. And that would be the first move that I would suggest before having to see the dermatologist. Because
it's a very delicate area around the eyes, isn't it? And I know even when I've talked to, clients about it, and I'm telling them before I send them over, right, to you, whether it's they live here or in another place, but I always say to them, around the eye, it's not a Q-tip, it's a toothpick amount. It's barely anything of, these prescription creams that you have to be so careful, because it's just a lot is not needed. You need just a smidgen, toothpick style,
Sure.
Yeah.
And to be aware of things that contact their eyelids, and it can be the towels that they're washing their face with. I guess sometimes detergent we think about. Things get transferred from the hands to the eyelids. Right now, we're not supposed to be touching our faces because of COVID-19, but it's probably a good idea not to anyway. Certain nail cosmetics may have chemicals, formaldehyde in the frosted ones, that if one scratches one's eye, you can get a dermatitis from that. There's a lot of things. So we play detective to see what else is out there that we're being exposed to. But, again, it's a sensitive area. And to start with, at least the Vaseline would be the way to go, and beyond that.
Well, I'm someone who loves sparkles. I don't know if it's just because I'm getting older. It's like here, I've done a braid in my hair. I went to a girls' boarding school and had to wear braids and, you know, hats and gloves when I was in boarding school. And I'm just like, that's really showing I'm getting bored here. I'm like braiding my own hair, you know. But I think it's very funny that I'm big into sparkles, and I notice, you know, a lot of the sparkly eyeshadows, they have that, I mean, I've been told they have like fish scales and things, but I'm allergic to some of them. But it's whatever it is, it's, you know, definitely allergy driven. But I wanted to tell you a story, but also, you know, just ask you about it a little bit, if you could explain something to me. When I had my son, he was a few months after he was born, he had really bad eczema on his face, really bad. And I went to a pediatrician dermatologist, and she said, I think he has eczema. And I won't even tell you. I'm rolling my eyes here thinking to myself, you think? I know he has eczema. But anyway, we won't go there. And she prescribed a cream for his face that was a non-steroid cream that I put on twice a day, never did a thing. I did it for months. And it then was taken off the market. And at that point, as I said, I used to get dermatitis on the tops of my hands. I had a prescription cream. I used it on his face. I put it on maybe 3 times at the most, completely disappeared and never came back.
Fantastic.
And I mean, you know, is there anything that you could say? I mean, I was just like, oh my gosh, well, okay, she thinks he has eczema, and now she's given him a cream that has been taken off the market as well, but did nothing, you know, putting it on his face for months, twice a day. I mean, is there something?
She was being a little excessively cautious, perhaps.
Yeah.
But so we do use cortisone creams. They're anti-inflammatory, and if used as directed, they should be safe and fine. And some of the stronger ones will be, you know, better handled on a place like your hands than on the face. But to do it once or twice probably aren't going to hurt anything. Mm-hmm. And you know, it's nice that it worked out and it went away and didn't come back again. You're lucky on that one. But it's a matter of, you know, it's when they keep coming back, then that's the challenge for us. You know, it's like, okay. And there are some good, again, non-cortisone prescription anti-inflammatory things that we use for eczema that are safe on the face. But the occasional use of cortisone it's phenomenal. It's a great thing, but you just can't, you know, you can visit, but you can't live there. You can use it a little bit here and there, but it's not for an everyday continual thing.
And I want to say that, you know, like any cream you put on your face, when I said toothpick style, it spreads. You know what I mean? It's not something that you really have to use such a small amount. I mean, I'm really, even once my clients, you know, they've got something, I'm saying to them, the tiniest amount is all you need. You know, it's almost like when you're using something, whether it be, you know, something for a brown spot or, you know, a topical, it's like putting it in the center of the brown spot. It's going to spread. Like you don't need to, or a pimple, you know, when people go to put something strong on to kill off a pimple and they end up with this huge mark, you know, that they're burnt or whatever, their skin that's 3 times bigger than the pimple was itself. It's just, you know, only a small amount is needed, and you can put it directly on the center of it, and it really does spread. I mean, I'm always telling people, you know, you really don't need much. You know, overkill is crazy. And clearly I've seen some of that during COVID-19 with, you know, some people being incredibly excessive, buying things that why is it that they sell, you know, 70% glycolics, professional strengths with a pH of less than 2%, you know, on Amazon? How is that possible, Brian, that they're able to do that?
I honestly think it's illegal.
Yeah, I mean,
they should not be able to have a strength that high that's commercially available. But Amazon, I guess there's some
Someone's so
not everything is regulated the way it, should be. But
no, I mean, I can
beware.
only use up to a 40. I mean, as an esthetician,
Right.
I'm not supposed to use, in California, I'm not supposed to use over a 40% with,
Right.
mine is a 2.8 pH and to a 3.0, that's as high as I can go. And yet people are able to buy, these over the counters and are really causing such problems, because it's not just that they're burning their skin and that their skin is, fried. And it's like now we've got to deal with the melasma as a result of it thereafter, and that's such a difficult, challenging thing in my industry, is for us esties, and I'm sure you too, is dealing with melasma, because it's, that once that tyrosinase, that cycle is upset, I mean, it's just a nightmare to, to keep it at bay.
It has been a challenge for us for years. And there's several things to focus on. First of all, there's some more recent theories that certainly sunlight and ultraviolet light is responsible for inducing melanocytes to make pigment, and why it doesn't do it evenly all over the face like a nice tan, I have no idea. Why does it have to be right here? And but there it is. So the use of a broad spectrum sunscreen is strongly advised. I'm a very big fan of the physical sunscreens. So zinc and titanium, and there's some clear zincs out there. It doesn't have to look like kabuki makeup.
Yes.
And now there's some theories as well that visible light and even computer screens may be partly responsible for aggravating melasma. And so we are turning to another physical blocker, iron oxide, which is found as a pigment in many makeups, powders, and there are pigmented sunscreens that have that. And it's been far more successful to do that, but one needs to do that on a regular basis. And even if you're not going outside, you're sitting in front of your computer screen, you need to protect your skin from that.
Yes, I notice, lighting and just heat. I mean, people that tend to be even, hot yoga and things like, I mean, when it's the hormonal influx of the, in how it just, certain times of the month for people, it comes out a lot more, and it's very, very tricky. And the treatments for that are, again, it's a continuous. They've got to be super careful with the sunscreen. I mean, it can be a trip to Cabo or Hawaii just one time,
right?
It sets them back, And what's interesting to me is sometimes, I've seen people that that don't have melasma, but then they'll go somewhere where it is a different sun, and that different sun, it does something, like they come back and now, they've definitely got melasma there. I mean, in Australia, where we have the highest skin cancer rate in the world, in Queensland, it's just, no pollution to filter the sun's rays. But and just hot sun that's so intense. I mean, you feel it burning, and it's so crazy. So I'm telling people, before you walk out of the house, you have to use, obviously your sunblock. It has to be, minimum 40 if you're, a fairer person and living certainly here in Los Angeles. But you've got to layer. You've got to put it on again and put it on again, like put on some layers on your skin before you even step out of the house. And if there's areas of the face where there is, more melasma, whether it be on your cheeks, your forehead, around here, then sort of layer a little bit more on those areas. And then, like you said, with the physical blocks, I'm a huge fan of the mineral physical blocks. That's La Belladonna, Color Science, the ones that have an SPF 50, that have got your retractable brush. Carry them in your bag, so that you're reapplying if you're out, because it's very tricky. And even, for guys, when they wear their colognes, and women that wear their perfumes, if they're not wearing it under their clothing and they have it here on the side of the neck, I mean, I've seen that reddish brown stain. It's, the alcohol in perfumes. And, you know, just recently talking backwards and forwards with a lady that's, you know, got a lot of the brown around her mouth, her lips. And I'm not talking above here, which, you know, often get with a contraceptive pill. And, you know, this area is sort of the female sex organs for women here. But around the mouth is, you know, often the lipsticks and the lip liner pencils themselves, you know, if they do have certain ingredients in them that, and perfumes, you see a lot of these makeups that have fragrance and things in them, that in itself combined with sun can stain the skin. So I think it's really, you know, important that people have to be very aware of this type of thing. And even when you're using a lip balm, make sure that has an SPF in it too, because you know,
that's a good
the
point.
lips, the tops of the ears, these areas are very, you know, very easy areas to get sun damage, and even in some cases, you know, little skin cancers, basal cell. I mean, I've seen them on the tops of the ears, and scary.
Yeah, you're right, and all those areas need to be protected. I will say that technology has moved forward a bit in the last several years, and there are some newer lasers that actually may be safe and effective for treating melasma in all skin types, which that's a game changer. But there are some that are out there now. The IPL should not be used. That is too dangerous, and the rebound is, you know, is terrible. But there's some newer ones that you know, we could talk about another time, but that are available for this. So.
Yeah, I think it's something I know, you know, I worked with a facial plastic surgeon for many years in Beverly Hills, and Dr. John Joseph, who is, you know, like yourself, he's an extraordinary facial plastic, but just a really truthful guy too, you know, and very, you know, quick to tell people, be very direct and truthful, which I really appreciate. And I know that, you know, for many years, a lot of the lasers, and I'm really tough about lasers and skin and melasma. And like you, Brian, you know, you see a lot when we're doing hands-on work. And it's devastating when, you know, people are paying a lot of money for things, you know, whether it be treatment face creams or whether they're having different treatments done, and they go in for one thing and they end up with something else as a result of that one thing. And my thing is that, you know, I have seen a tremendous amount of damage from lasers. And even working with Dr. Joseph for many years, you know, he did come in one day and he said to me, you know what, Nerida, he said, you're right about the laser. You know, they do make melasma worse. Now, I know that, you know, technology is advancing, and I would love to come back on with you another time and talk more about this, because I am incredibly tough about laser. And just because I also want people to understand that, you know, it's what you do every day that makes a difference. It's like for the people that aren't using sunscreen, that aren't taking good care of their skin with home care, and then they'll go see you or, you know, Dr. Joseph and want to do a laser. It's just like, no. Like, hold on a second here. Let's make sure that what are you doing at home? You know, like what I think people need to understand, you can't not do anything and then go to yourself or Dr. Joseph and expect miracles and then go back to home to not doing anything. You know, I think that people need to understand, like I say to them, don't even bother going to see Dr. Mekelburg or Dr. Joseph right now, until you are using what you should be using at home, and that you are protecting your skin. Because it is, you know, because by the way, they're going to be the first ones calling me saying, I've got this problem. You know, it's like people need to think, to be responsible and say, well, you know what, not only am I going to be spending money and, you know, and helping this area, but, you know, they need to take responsibility, and they need to have a good home care regimen. They need to have their products that are going to be supporting their skin long-term and protecting it. Because going and having a laser and doing things like this is not going to help you if you are not using sunscreen every day. And by the way, wearing it inside. I mean, I've got a 50 on my face right now, and I'm inside with lighting.
Yeah.
You know, it's very important that people understand this, because they're, you know, if you want results, and we all do, we all want to stay young and looking fabulous, right? But they're not going to have that result long term if they are not taking care of their skin. So I think, you know, big message in it for me, and I'm tough on my clients, and my clients, which, you know, I know that they appreciate, because I want them to get results.
And I know that they do appreciate you, and I will say that you are one of the very few people that I would send my patients to, and I think you have a very good handle on skincare. And
well, thank you.
I give you a compliment on that.
No, you know, I just think it's really important, and I think that, you know, the importance of home care, and that constant reminder to our clients that, you know, before you go and have laser, please tell me what you have at home. Please tell me how you're using it. And I think that that's something that I would like to see, actually, more doctors talking about this, and you know, talking to them about home care more, and just making sure that they've got their stuff. It's like, no, you're not having this laser unless you buy not just one of these sunscreens, but two of them, you know. It's sort of, you know, I think it's that important, because, you know, because the more advanced we get with our equipment and the lasers, the more fabulous it is, but it's not fabulous if they're not doing their home care, and if they don't understand the importance of that, and, you know, and clothing and things that protect your skin from the sun. Because, you know, I'm almost 60 years old, and I, you know, come from a country, as I said, the highest skin cancer in the world. What has saved my skin is staying out of the sun. And, you know, my torso, is like a 26-year-old, because it hasn't had sun. So
Fabulous.
the one thing that we do know is that UVA, it damages the skin. So please, guys, you know, understand this, that you have to, you know, you've got to use your sunscreen. You've got to use products that support your skin long term. You've got to use sunscreens. Then you can go ahead and have the lasers and things done. But I really want people to understand, you know, the education behind home care is so important, because, you know what, that's where they are most of the time. And not everybody can afford to be having, you know, different treatments done. It's take care of the skin, protect the skin from the sun. It's so important. You know, that sun is majorly damaging. Not only does it give you brown spots, it's that UVA. Talk about make the skin loose. I mean, you know, really damage. So I'm so glad that you're talking today. Also, that you talked about, you know, the zinc oxides, the iron oxides in sunscreens, the importance of sunscreen, wearing it inside, whether they're in front of their computer, you know, with lighting. All these things are really important. And I would love to have you back and talk more about lace. I know there's been a lot of questions come across the screen, and I apologize to all of you not being able to answer them. I wanted to pick his brain and share with you as much as I can, because I know without Dr. Mekelburg in my life, I would be stressed, because you guys, you've got to have a good dermatologist. You know, you need to go to somebody who, number one, takes their time, listens to you, and really can guide you through your treatments. It's really important. So Dr. Mekelburg, he is here in Los Angeles. He's based in one of the Cedars-Sinai buildings there on 3rd Street. He is a superb dermatologist. And I know, you know, here you are in front of me, but I'm telling you, you have actually, I've had people come to me that have had basal cells, and I've said to them, you know what, they didn't work, this didn't work for you, you need to go, you need to have it treated again. And then I've sent them to you, you've taken care, not only taken care of them, you've recognized it, you've got rid of it. You want to be with a dermatologist that is thorough, that spends time with you, and that is a true derm, that still wants to help you with your skin, you know, and not just be injecting you with fillers. So thank you for all that you do out there, for my clients that you've treated. You know, if there's anything I'll tell you, they laugh, because they say the one thing is, I love, you know, but you've got to have a little time. You might have to wait a little bit.
Yeah. Well, that is true. Things have changed right now, by the way, and there's no waiting in our waiting room, because people don't wait. We put them right in the room, and
yeah.
but
it's so great because I mean,
yeah.
I'm just so glad to, you know, to have you in my life that I can
Thank
send
you.
people to, and I know that you're going to take care of them. You're not going to, I mean, just across the board, guys, it's really important to find somebody that you trust and that does, you know, that does great work. Dr. Mekelburg, thank you so much for being
Nerida,
here
thank
today
you for having me.
and talking with us. And I would love to have you back to talk more lasers because it's a subject I'm a little, you know, it's, you know, obviously just, so I'd love to have you back to talk more about that.
Pleasure.
And thank you. I mean, guys, thanks for joining. We will be looking at some of the questions. I'm going to have Dr. Mekelburg back. We will answer some things for you. Take care of yourself, and I'll be in to see you soon.
Okay, great to see you. Thank you so much. This was a blast. I enjoyed it. Bye.
Thank you.
Bye.
Bye, everybody. Thanks for joining, and we'll be back again next week with another live. So thanks for joining us. Bye-bye.